pleased to have joining us now in studio to talk about our Day of Giving, Shawn Patterson. He's the Director of Respiratory Care and Neurodiagnostic Services at Bakersfield Memorial Hospital. That's a mouthful.
It is a mouthful.
All right, Shawn, thanks for joining us, and it's great
Thanks
to
for
see
having
you
me.
again.
Good to be back.
You have been at Memorial Hospital for about 8 years now. What has it been like for you to watch the Lawrence Small Children's Center grow and expand over the time that you've been there, and a little bit more about your excitement about this new surgical suite that is coming in?
It's been amazing. Over the last 8 years, we've dramatically increased our services. We've been able to add some new services to our pediatric areas and the NICU specifically. The NICU, recently we opened up our cooling program so we can cool off babies. The cooling program is very interesting because anyone in the outlying area, if they have any type of birth trauma at all, that can cause potentially swelling in the brain for patients. So we like to cool them off with our new cooling program. So we're the only ones in the entire valley that have the cooling program.
And that NICU is really the heart and soul of Lawrence Small Children's Center. It was the first unit.
That is correct. So that is one of our big accomplishments this year, was the cooling program we started. But then now that we're going to have the pediatric surgery suite, everything is aligned with us having all of our patients stay here in Kern County, not having to leave the area for their care, which has always been our mission. We want to make sure that we can do everything possible here in town and not have to send our patients and their families, which is a critical element of that, is not having to send them down either down to LA or to Fresno, Madera.
Valley Children's.
Children's.
And I was just telling Jim, 14 years ago, actually almost to the day, my daughter, who was an infant at the time, had to go to Valley Children's Madera to have surgery. So,
and that was typically the case previous to this. But our goal now is to keep everybody here. It's extremely hard on the families to have to go receive care out of town.
Yes.
It's hard on the family. It's hard to have to travel, to try to find someplace to stay, to have to potentially miss work. So doing everything we can to keep the patients here in Kern County is our mission.
It's a worthy and lofty goal.
And let me ask you now, given our infamously poor air quality here in Kern County, unfortunately, in the Southern Valley, how crucial is it that kids get that respiratory care that they need here at home instead of having to travel? Because this could mean, for some, a matter of life and death.
It is. We have some of the worst air in the country. I think most everyone would realize that. And with that being said, we have a lot of asthma here. We have, for our kids, which is our Day of Giving now, for our kids we have a lot of asthma. For our adults, we have a lot of COPD, but for the kids, we have a lot of asthma. That's a lot of emergency room visits for their asthma treatment, for the respiratory therapy. So we have children that are highly impacted just by the quality of the air and where we live. So it's a very big deal as a respiratory therapist. It's one of the things that we do is take care of things like asthma. But a big one for us today is the surgical suite and the NICU. That's where we spend a lot of our time as respiratory therapists, delivering different levels of care for them.
As you well know, our viewers are an indispensable, vital part of the evolution of Memorial Hospital and the Lawrence Small Children's Center. Anything you'd like to say to them tonight?
Absolutely. You guys are an incredible part of this. Our community is amazing. We have some amazing physicians and staff members, our nurses and respiratory therapists. All of our staff members are amazing. But without the partnership of our community providing the resources and all the equipment and special technology that we require for these types of patients that we have, without our community and the giving that we have, we wouldn't have all that. We wouldn't be able to take care of the patients right here in town, which is what we want to do. So without your support, we're not able to do that.
Yeah, we have an incredible giving community, and so I know folks are going to pick up the phone.
We absolutely do. Thank you all.
Blessed to have
everything
you with
matters.
Yes.
Blessed to have you with us tonight, Shawn Patterson.
Thank you again for having me back.
Keep up the good work.
Thank you, Shawn. Appreciate it. Thank you so much, and happy holidays.
Happy holidays.